In the words of my father, Luis Ramirez, la medicina está demasiado cara. The cost of prescription drugs in America is too darn, we'll say, high. Too often I hear from my constituents talk about the impossible choices they have to make between paying rent, paying for groceries, or affording their inhalers. And in our nation, a person with asthma pays about $1,830 per year just for life-saving emergency albuterol, $1,830. And I'm grateful to have been part of the movement in Illinois to cap the prices of prescription drugs. I was in the Illinois state legislature when SB 667 came to the floor to cap the price of insulin, and I had the honor to be a co-sponsor and vote yes on that bill. And of course, I'm grateful for the historic legislation passed by Democrats to cap the price of insulin and allow Medicare to negotiate the price of prescription drugs. But folks, we're here because we know we have to do so much more. Too many lives are on the line. You've heard it from my colleagues today. Our family, our friends, our neighbors, our constituents, they depend on us to continue to advance efforts that reduce the cost of and increase the access to medication. You see, in Illinois, my District 3 is comprised of working people who depend on these efforts. 12% of my residents have income below the poverty line. Over 82,000 people have no health care insurance coverage whatsoever. 233,000 of them rely on public programs for coverage. And multiple communities qualify as medically underserved. But when the unchecked corporate greed of pharmaceutical companies meet the lack of proper regulation of prescription drug prices, families in my district and all of our districts suffer. In my district, families have found relief in community health centers like Erie Humboldt Park Health Center that provide essential comprehensive health care. And because of regulatory programs created by Congress, like the 340B drug discount program, healthcare providers that serve low-income and uninsured communities are able to purchase drugs at a lower cost and help patients afford their medication, their insulin, their inhalers, their blood pressure medication, their Narcan, their PrEP, and more. In addition to helping patients afford their medicine, we know that community health centers provide the high-quality, comprehensive care patients with chronic conditions need to thrive. Programs like the 340B drug discount program and high rates of utilization of community health centers across Illinois show us how critical it is for Congress to take action to address how unregulated, greed-driven drug pricing holds our families back from realizing a better healthcare outcome and fuller and more vibrant lives. And look, the truth is that the prescription drug pricing system is intentionally complicated and confusing. That's why we need all those charts, Raja. It's a predatory practice, and everyday Americans struggle to understand what is covered and how much it's going to cost them. It's clear we have both the opportunity and the responsibility to address this broken system that regularly puts profits over people's well-being. And for the last 2 years, I've had the privilege to serve in the Veteran Affairs Committee, where I've seen firsthand the potential of models that prioritize coverage and life-saving medications for our communities. And as I work with my colleagues in the committee to ensure the proper implementation of the historic PACT Act, it is clear that we have the models, we have the tools, and we have the capacities to ensure that every family has access to care and assistance they need. But we have to continue to advocate for Medicare for all, to provide comprehensive benefits to every person in the United States, including primary care, including vision, dental, prescription drugs, and more. We have to bring the full power of the federal government, regulation, legislation, and the word you've heard here from my colleagues over and over, negotiation, to fight for our constituents so they never have to forgo necessary prescriptions. Today, I look forward to listening to experts about the crucial steps we can take together to ensure that everyone, regardless of zip code, regardless of migration status, have access to the medicine they need, they deserve, to care and the care that they deserve, and the help that we know our nation can provide. Thank you, Senator Durbin, for this opportunity and for this hearing.
Thank you, Congresswoman. Each morning in the Senate, the Republican leader and Democratic leader make statements, and I am usually there to hear them. One recent statement made by the Republican leader, Mitch McConnell, was in reference to the negotiation of drug prices. He referred to it as, quote, pharmaceutical socialism. pharmaceutical socialism. I'm glad you brought up the fact that the Veterans Administration has been negotiating drug prices for decades, saving the taxpayers a lot of money in the process and making sure that the men and women who served our country still receive the very best when it comes to medical assistance. I don't think that's socialism. I think that's basic to America and our democracy. I want to thank you for raising that issue.